Welcome back to part 2 of my 6th YouTube video on coronavirus. By the way, now that you're already into this, everything I say is predicated upon us not having yet discovered a drug that cures this disease or a vaccine being developed that's available to everybody to vaccinate against it. Once that occurs, then we're in great shape. Yes, remdesivir has been shown to reduce hospitalizations from 14 days to 10 days. That doesn't stop people from dying. And also remdesivir is an injectable drug. You can't take it to prevent the disease. Now, let's go back to hydroxychloroquine. I think I was the first in the country to warn about hydroxychloroquine because it's something called a 4-quinoline, which is a chemical family. And my company had the first approval, the first FDA new drug approval on quinine, which with one chemical change becomes chloroquine, with another chemical change becomes hydroxychloroquine. But those other drugs hadn't been studied because they were old drugs, like we did when we got our quinine approval. And we have on our package label, I'm retired from the company now for a lot of years, but we have on that label is that macrolide antibiotics like azithromycin can interfere with the liver's ability to break down quinine, and you would expect, since it's a similar chemical group, hydroxychloroquine is, that it would also cause hydroxychloroquine levels to also rise because hydroxychloroquine cannot be broken down by the liver. The point is that there's studies now, very concerning studies done across a lot of people retrospectively that show that giving hydroxychloroquine, and I don't know how many of these people took azithromycin also, caused a great increase in the number of heart attacks and a great increase in the percentage of deaths of people who are very sick with coronavirus. But there are still studies going on hydroxychloroquine to see if it can be used to prevent coronavirus or to treat in the very early stages. But as I said, maybe a month and a half ago, you can look back on the YouTube videos, that taking hydroxychloroquine like this is something that people should at least get an electrocardiogram done and always be done under the care of their licensed medical professional. Okay, so let's move on. The other thing we need everybody to stay at home for at least 2 months, hopefully 4, 5, 6 months, and that's done across the world, and this thing will die out. Now, why can't we do this? Obviously, first of all, you need lots of essential services. But there's another issue. What is $1 worth? What is $1? Is $1 worth anything? You can't eat it. I mean, I guess if you're crazy, you could, but it's cellulose, so you don't have the enzymes to digest it. You can't put it in your gas tank and drive your car. So, what is $1 worth? The answer is, $1 is worth, and this is a very critical fundamental in economics, $1 is worth the goods or the services that it can buy. So if you can take that $1 and you can buy a spoonful of butter, then that's what it's worth. If you can buy a pound of butter, that's what it's worth. If you can buy 100 pounds of butter, that's what $1 is worth. So there's a certain number of dollars in existence. I know we're printing more, but for the most part, a certain number in existence. And the country that is producing the goods and services that are behind that dollar, that are giving that dollar value, has stopped. Not 100%, but substantially stopped. Now, you can't do that. You simply can't do that. You have to go on. The economy must function. We must produce goods, and we must provide services. Otherwise, you're looking at a potential economic catastrophe. By the way, as a note, if you look back at my old videos, if you would have bought stocks when I told you to, you would have made a lot of money. That's neither here nor there. Sorry. Okay. So what happens when a country doesn't make enough goods or services, makes very little of them, and yet has a lot of dollars around? I'm going to show you $10 trillion. You heard me right. I'm going to show you $10 trillion. Here it is. Hold it closer to the camera. That is $10 trillion. And it is from the country of Zimbabwe. And it says on it, $10 trillion. It was real money. Zimbabwe has since thrown away the currency. By the way, you can buy those on eBay for like $1 each. You can't do anything with it. It's just a fun thing. So we have no choice economically. We must be producing goods. Therefore, we cannot have everyone stay in quarantine. So now, what is the answer? This is what we have to do. We have to tell everyone, you can leave your homes, you can go back to work, you can do whatever you were doing before, as long as you wear a face mask. And the government needs to implement, in my opinion, draconian punishments for being found off your property without a face mask. I would propose a $5,000 fine or 1% of your annual income, so that wealthy people don't think, well, I'll just do it. Who cares if I pay the $5,000? 1% of your annual income for each time the person is cited for being outside off their property without a mask. Now, the mask is not to protect yourself from others. And that's why the masks don't have to be virus sieving masks. The mask you're wearing is to protect other people, not to protect you. It's to protect the other people. So, because when you talk, or you laugh, or you sneeze, or you cough, little droplets of saliva or mucus fly out of the mouth, and the virus rides on them. So you just need to have something over the face that will catch those particles so they won't go and infect other people. And then with that, you got to let everybody just go back to work now. Now, here's some issues. I don't know what to do about bathrooms. There are medical studies, scientific studies showing that in commercial bathrooms, commercial toilets, where they have like a jet engine flush, like that it aerosolizes, it shoots a lot of the germs into the air. And if you test the handles for the faucets, you test the walls, you'll find that the bacteria from the excrement is all over bathrooms. We know that coronavirus can be excreted in the stool. We know some people get their chief symptom from coronavirus is diarrhea. So I don't know what the answer is. To me, it's something like the government has to test. If you put, I'm making this up now, if you put 100 cc's of chlorine or bleach into the toilet bowl each time, would this stop that from happening? I don't know. You have to have other provisions put in place also. You have people have to bring their own lunches. They can't eat in a company cafeteria, or they can't eat in a school cafeteria. They have to eat at their desks. People, if they're in offices, have to stay in their cubicles and not go to another cubicle. People on a production line, a manufacturing line, have to stay in their spot and not go to other spots. Have to be a lot of controls put in place, and social distancing should continue. But we simply can't stay in place anymore. Plus, it won't work. There are too many people that are violating social distancing laws and quarantine rules, and that's been going on since the beginning. I saw surveys done showing that about only 60% of people in the general public were taking quarantine seriously. I can tell you, in my Orthodox Jewish community of Lakewood, the place was like a ghost town. Yes, there were a few violations here or there, but the number of violations that happened in our community were very, very small compared to the number that were going on in many other communities or cities around the state. So, but the trouble is, there are a lot of people who have not taken it seriously. Plus, you're going to have to open up international travel. You're going to have people with the coronavirus traveling in. Stop taking temperatures. Stop taking temperatures. I said this 2 months ago, 3 months ago, in late January. I said taking temperatures is a farce. It doesn't stop anything. you got to stop taking temperatures. It doesn't work. The issue is before people get the fever, that's when they're infectious and nobody would know it. Hopefully people know now they have when they feel sick, they have to get tested for coronavirus. Now I want to speak to you about some false statements or false presentations that have been made. Some of them are not false because people intend to mislead you. They're false because the people are being imprecise with their language. Here's one. One of the major national news sources said, people just want to know when it's safe to go out. Here's what I want to tell you. It will never be safe to go out. Never. And I'm sure of this. It will never be safe to go out. There's about 40 or 50,000 people a year that die in car crashes. There's crime. There are people who slip and fall. There are viruses. There are bacteria. There's drowning accidents. There are people not in traffic accidents because they're driving. They get hit by cars. There's lightning. There's meteors. It will never be safe to go out. Okay, I'm being a wise guy, right? Because they mean, when will it be safe to go out in terms of coronavirus? That's not the right question necessarily. We all manage risk in our lives. People who are at higher levels of professional management of business or money, they all make calculated assessments of risk. But you take risks all the time. You all know that when you go out in a car, you might die in a car accident. You know that. But you've weighed in your mind, consciously or unconsciously, that the risk of dying in a car accident is well worth the advantage that traveling in cars gives you. If you want to live a long life, please, anybody with anorexia nervosa, I don't mean you need a doctor. But being slim, not being overweight, and by the way, being obese, it looks like might be the number one risk factor for dying from coronavirus. But we're all aware that being overweight is a risk to health. It's a risk for heart attack, stroke, cancer, and many other ailments. And yet, so many of us, and I'm not saying that I'm immune to this. I guess immune was a bad choice or a pun, but we eat too much, and thank God we have the food to eat. But we make a decision. We make a decision. We make a risk calculation. I'll tell you something. When I was at Harvard, I did a rotation through the cardiac intensive care unit, and there were many patients who had smoked like 4 packs a day for like 40 years. They gave up smoking immediately. Why? Because they had a tube through their groin, up their aorta, into their hearts, with a balloon pumping for them until they could get a heart transplant. Now they decide the risk wasn't worth it. So they made a very bad judgment, a risk calculation. So we all take risks in our lives. So the question is, how much increased risk is there to our lives if we are out of quarantine and we go out and stop social distancing? The answer is, first of all, if you're under 50, maybe under 60, and you're generally in good health, you're not obese, the risks are probably very small. Not zero, but small. And by the way, about half the cases of people getting sick with coronavirus are people under the age of 40. And when we talk about the risk of dying, yes, those risks really increase over 50, especially over 60, and then way over 70. They also increase greatly with diabetes, with hypertension, with pulmonary disease, with obesity, and there's some others. But if everyone would wear masks such that the government, like I said, strictly enforced wearing of masks, then I think, I don't know, but I think that everyone could basically, almost everyone, except those at the very highest risk categories, could go about living their normal lives inside their homes, of course, but also outside their homes. What's happened now that with Memorial Day and a lot of people are just like broken loose and ignored the quarantine and social distancing guidelines, I strongly suspect with about a 95% certainty, 5% is not zero, but a 95% certainty, and I'm not pleased to say it, but I think that we're on the verge of seeing in the next 2 weeks, maybe even the next few days, a massive, massive outbreak of coronavirus across this country. So is it safe to go out? If everyone is wearing masks, then the risk of getting coronavirus has been minimized. And given the other risks that we take in our lives, yes, everyone should go out. Of course, you have to speak to your own licensed medical doctor to help you make your own decision. This is my opinion, though. And we need to go out. We need to jumpstart this economy full speed ahead. And the people that are ignoring social distancing and ignoring wearing masks, they're not helping us. They're hurting us, because I think they're going to throw us back into a wave of infections, numbers far exceeding what we already have had. And by the way, we're still having about 20,000 new cases every day in the United States. We've had over 106,000 deaths so far.